EGM Network.
Honestly, without Treasure Coast Community Health, I think we'd be a much poorer community in terms of our health. We're always striving to fill the gap for everyone in the community, rich or poor.
Good afternoon, and welcome to Community Conversations. If my timing is a little off today, it's because I'm sitting in a beautiful studio that has been supercharged to be more like a living room. But all the usual markers that I depend on are now in a different place. So it's wonderful. We really appreciate still being here at this wonderful studio with the wonderful partners that we have. But for those of you that see us on Facebook or streaming, know that we're going to have a little up and down. At least I am. So bear with us. As usual, we have recruited around town to have people with interesting things to say. And so this week, I'm thrilled to have, what's your name again? No, I'm kidding. The Mental Health Collaborative is led by Wes Samons. And actually, I sit on his board of directors, so it's just a little inside joke.
Well, it's funny. It's funny that you mentioned that because I was called Brett this morning by one of our neighbors in our office. So yeah, I was like, all right.
That's a couple years ago now.
Yeah.
Although we do miss Brett.
Well, of course, absolutely. But yeah, 2 years actually next week. So and I'm thrilled to still be here, be in this position. So
well, and Brett was a part of us for a long time because the Mental Health Collaborative actually started many years ago, and Brett was one of the first leaders of the group that helps coordinate things. Mm-hmm. The Mental Health Collaborative is a group that's made up of providers, funders, law enforcement, community members. But it was not until about maybe 5 years ago, maybe longer.
8 years ago, I believe, is when they started the Connection Center. So yeah, so the collaborative itself is in its 20th year.
Wow.
So
time flies when we're having fun.
I know, right? Yeah. So we just celebrate our 20th year. Sorry, it was last year. So we're actually in our 21st year now, and but the McCabe Connections piece that the community is more familiar with started 8 years ago, and that's how we refer people to the services that are needed.
A loving legacy from Ellie McCabe,
absolutely,
that has grown on and is serving a vital portion of our community relative to mental health needs.
Yeah, absolutely. We typically, on average, we serve 1,000 to 1,100 residents each year. So, and we're kind of on that same pace again this year. So, yeah.
It's confusing, though, to many because the Connection Center does literally connect providers and patients. You provide no direct services, that is patient therapy and medication management. You look for a match that works.
Yeah, correct. Yeah, so we don't actually provide the direct service, but instead we are kind of a linking entity. So we take someone's basic information, most importantly, what insurance they have, if they have insurance, and we link them then to a provider that has availability. So if they're looking for therapy or psychiatry, we can link them based on availability of providers and what insurance they have. And if they don't have insurance, we have a benefits specialist that can help them to apply for insurance.
That's very important, particularly for those that do have chronic mental health conditions, having them be able to apply for SSI or SSDI, I guess.
Absolutely.
And so that, that's a pretty scarce resource in our community. So I'm very grateful for that.
Thank you. Yeah, it's obviously, it serves a important purpose in the community. And so I'm happy to
and then through the years, even though it's connections for mental health, you guys have kind of evolved into more of a wraparound service as well.
And we get, it's funny, we get calls for all kinds of things. A couple weeks ago, I had someone looking for a plastic surgeon. And so, just things like that. Yeah. So, a lot of times, unfortunately, things that wrap around housing and just trying to have your basic needs met. And, I try to train our staff to not say we don't do that, but more so, let me get back to you. Let me see what resources I can find. And through all the connections that we've made in our community, we usually can find some options for people regardless of what they're looking for, not just mental health services.
And then the Mental Health Collaborative itself, besides the Connection Center, that has also expanded with things like mental health first aid.
Yeah, so that's kind of the collaborative piece is a lot of prevention and education for the community. So working on things that we feel like we can bring into Indian River County that fills a gap that might be there. And one of those things is mental health first aid, helping our citizens to identify someone who may be in a crisis, mental health or substance use crisis, and how they...
And then saying the right thing. I always...
I think
choke and say,
that's right.
I don't want to cause any harm.
Right. Yes. Yeah, exactly. Right. So teaching them how to approach that person and not feel like they're going to do damage, right? They're going to be able to help link that person to the resources they need and to be an active listener that might help them to de-escalate.
And I think that's wonderful because I don't think there's a family in the county that doesn't have some exposure to someone who's struggling with mental health.
Absolutely, and that's the feedback that we get, and that's why we've been able to offer the program for, I think this is our third or fourth year now of offering it to the community and having trainers in the community, just because we see the need and the feedback says that, there's continues to be a need.
So if someone were interested and this is the first time they've heard about it, how would they connect up to find out more about it, what its costs are, when the program, because it's 8 weeks? 8 hours.
It's 8 hours. Yeah, no, it's only 8 hours. No,
I remember the 8.
Yeah, it's 8 hours. That's right. Yeah, it's a one. So we can break it up into 2 days, 4 hours, or 1 8-hour session, and you would just reach out to us at the Mental Health Collaborative, and we can let you know when we're having a public training, which we usually do one a month or so. Okay. And then also sometimes we provide trainings for organizations, and if they are open to having someone come in, if there's an opening, you can also be part of that, and it's free. It's free to the public.
What organizations have taken advantage of that?
Cleveland Clinic has. We do a lot of training with Cleveland Clinic. That's kind of been the main one recently. Healthy Start also does a lot of trainings for their participants in their different programs as well. So those are kind of the main two recently. Sheriff's Department has utilized the service in the past as well, and maybe circling back to them sometime in the near future to train the new officers. But
so you all thought I was going to say Treasure Coast, but not yet. We have a separate training.
Yeah, and we're always like we're open to any kind of in-service from an organization like TCCH.
From that experience, though, this summer you started another program.
Yeah, we did. So a branch off of that I'm really excited about is Teen Mental Health First Aid. So that's literally directed at teenagers 14 to 18 and helping them to identify a peer that might be in the same type of crisis as we spoke about. It's not training them to be therapists. So I just want to make sure that's clarified. That it's literally just helping them to identify someone in their class, in their school that may be going through something, and giving them the tools to help that person.
We've talked on many occasions about how communications, the ability to communicate clearly and articulately through high school has changed over the years because they do so much by text.
Sure.
And so they don't have the same amount of practice in social situations. So I think it's wonderful. I was confused initially because I had heard that the school was doing mental health first aid teens, but that is specific training that the teachers get.
Correct, and
which is different.
It is different, yes. So that one is it's child mental health first aid. So it's teaching an adult how to de-escalate a child, so someone who would be in the school. Okay. So that one is geared towards adults who are focused on children that may be going through a crisis. So it's slightly different, but all the teachers, I think the state mandate is 80, I could be wrong on this, I think it's 85% of the staff have to be trained. And so I know our district does a good job of making sure.
Yeah, we had a school health advisory committee meeting a couple of weeks ago, and they have certainly exceeded the expectations in every area.
Yeah.
Not surprising since our school district is really at that A level. Our superintendent was recognized as the Florida Superintendent of the Year.
I saw that, yeah.
One of 4.
Yeah, that's great.
It's great because he's not done it from an ego point of view, but rather what's best for kids, and who can't wrap their head around that.
Right.
So in that mindset, I see that you have a little flyer sitting there that you brought in.
Sure, yeah. There's a few events coming up for the community, for the public, that I wanted to make everyone aware of. And the first one is the Family Fun Fest that is hosted by the Thrive Coalition and the school district.
Formerly known as the Substance Awareness Center.
Exactly.
Yeah.
Yes. So
Third
now
year?
Thrive. Yeah. This is the third year of the event.
Yeah.
I think this is the third year. It's the third year that I've gone. I don't know if there were some prior, but it was well attended the first 2 years.
Absolutely.
For sure. Yeah. So it's at the IG Center, the Intergenerational Center again.
Okay. That's all fun to town.
Yeah. And DJs, or a DJ, bouncy house, food trucks, all the fun things that you want to bring your kids out to experience. And obviously, a lot of the community providers will have tables there where you can get information.
Last year they had it. It was like a bingo card.
Right, exactly.
And if you stopped and had each of your squares marked off, then there was prizes.
That's right.
There too.
So you go into a drawing to receive a prize if you visit all the vendors. So I think there's
a lot of great information for families there.
Absolutely.
Those of us that are in this profession and have been in town for some time understand the resource that we have, but it's fun for the kids and it's interesting for parents.
Yeah,
so.
Absolutely. There's enough things for the kids to do that the parents can gather the information and focus on, like what they're learning about the different organizations and what, what's out
great
there.
Connections.
Right, exactly.
So speaking of which, we're going to connect to our sponsors for a moment. And when we come back, I know you've got another event up your sleeve and we'll talk about that. So
that's great.
Stay tuned. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
Right now at Sunshine Furniture, it's New Year's sale time. Save up to 50% on selected closeout styles of Lloyd Landers, Berlin Garden, Capri, Universal Coastal Living, Four Seasons, and lots more. Sofas, dining sets, patio groups, chaises, umbrellas, occasional chairs, bedroom sets, coffee table, lots of pieces on sale now for inside and out. We're your local Tommy Bahama and Lexington store where you can create an island paradise and make your life one long weekend. Sophisticated looks with a mix of coastal and Caribbean style, Tommy Bahama Home has everything you need for your Florida living. Also, all pictures, lamps, and accessories are half price. Visit Sunshine Furniture now for our January sale. Sunshine Furniture, 1295 US 1 in the Publix Plaza, Vero Beach. Visit our website at sunshinefurniturecasual.com. Also, don't forget to shop our outlet and sales center just across the street.
Sunshine Furniture, the best in every way.
Giddy up and ride out to the Downtown Country Hoedown presented by GHO Homes, a big old party in Vero with live music by Justified. Midway games, a mechanical bull, line dance, and beer food contests and prizes. Admission is free. Presented by GHO Homes, Main Street, Vero Beach, Millennium Cremation Service, and Formula One Window Tint. Admission is free at the Downtown Country Hoedown. Friday, January 31st at 6 p.m. in downtown Vero Beach.
And welcome back to Community Conversations. If you're just joining, my name is Vicki Soule. I'm the CEO of Treasure Coast Community Health, where we provide primary care. Now, what is that? That is all things that keep you healthy. So it might be medical, it might be dental, behavioral health, substance use disorders, pharmacies to attack your chronic conditions at a very, very reasonable price. But we know that we're just a part of the greater nonprofit group that operates here in Indian River County and makes life so enjoyable. And so many of my guests are other nonprofit folks that are offering services. And today is no exception. I have Wes Samons here from the Mental Health Collaborative. We've been talking about the 20-year history of the collaborative, the mental health group that connects folks that are looking for resources in the mental health field, and some of the things that they have evolved into being a major part of. So we stopped with the IG Center coming up, and what was that date again?
That is February 8th, so a week from Saturday.
Family Fun Fest.
That's Family Fun Fest. That's right. Yeah.
So if you haven't experienced it, whether you're young or old, have a family or not, you're going to see a ton of community resources, folks there with lots of fun things to do, lots of things to see. There might even be a food truck or two.
There's a few of those usually, yeah. I believe last year there were several, yeah, for sure. So that's a great event for you to bring your children to, your kids to, and there's a lot of activities for them. Another event, though, that I'm very excited about is a parents-only event or caregivers-only, and it's Parent Academy. So this is the inaugural event of this, and it came through the Thrive Coalition and some of our community initiatives that we wanted to focus on parent involvement and ways that we can help parents.
That's awesome, because so much has changed socially. It's sometimes hard to know how to react and how to navigate. You don't want to screw your kids up for a lifetime. But the reality is that the social support systems that we counted on so much, our parents, our aunts and uncles, our good friends that we had lived next to for 10 or 20 years, a lot of that has changed. They're farther away, or we can't communicate with them for one reason or another.
Right. Well, yeah, and like the old adage that it takes a village, right? So now a lot of people's villages are shrinking, and so it makes it difficult sometimes to.
You can't Google everything.
Right, exactly. That's right. Yeah, and the sage advice you might get from an aunt or an uncle that has gone through this process before, that's not as available as it used to be. And so we felt like as a community that we could put together an event to where there would be various topics covered as far as like diet and how it affects your mental health and your physical health, navigating the social media and how that can be an issue, and what steps to take to make sure that your kids are not being exposed to things they shouldn't be exposed to at an early age. So just various topics like that will be presented in like a class, like a school setting type fashion. It is actually held at Gifford Middle School.
Okay.
On March 1st.
Yeah, county.
Absolutely. Yeah. So it'll be in a school setting, and there'll be basically 4 different periods to where you can attend 4 different talks on which of the 10 topics interest you. And the good news about that as well is if you want to attend more than the 4, all 10 of the presentations will be given out as well, like the PowerPoint handout. So you'll be able to receive the information on every speaker, but you can also attend 4 of them in person.
I'm so glad to hear that, because when I go to a conference, invariably they'll have multiple offerings, and the 2 that I really want to hear same time.
Right, exactly.
And it's so frustrating.
Right, we've all been there professionally, right? So so we're hoping that this is something that we can continue to do. Like I said, this is the first one. It's free to the public. The breakfast will be free as well and will be served. And at the conclusion of the event, we'll have vendors there like Family Fun Fest, where there'll be tables of the different community partners and the resources that hopefully after they attend some of these talks, they'll be more interested in taking advantage of.
So like a
things.
conference, will you have feedback sheets for the people that participate if they would like to say, yeah, this was great, or bleh?
No, yeah, we're absolutely.
Didn't interest me as much as I thought it would.
That was one of the first things that we talked about. Kelly Williams, who's been great from Cleveland Clinic, and Sarah Ainge from the school district have kind of been the 2 other chairs of our part of this coalition initiative. And that was one of the things that came up. Was like, let's make sure we have an exit survey so that we can get feedback on, like if you attended this again, what would you like to see different? Because our hope is this will be something that we can offer once or twice a year, and sometimes change the topics and have different speakers.
Well,
obviously.
I really appreciate that, because again, as a parent, there are some things that you really want to focus in on. And we have other community talks, community information things like, I'm thinking of United Way's Powered by Purpose, where a topic is chosen and then a panel discusses a lot of different things from their perspectives. But this, tell me again about how long the sessions are going to be and how will the information be relayed?
Sure. So each talk will be basically 30 minutes to 40 with 5 to 15 minutes of Q&A at the end so that the audience can, obviously ask questions.
Clarify
Right,
and,
of course.
get more information.
Right. So each one will fit within an hour, and then they'll have time to kind of transition to the
Where am I going next?
just like a class schedule, right? You have a bell and everything.
Okay.
So that'll be the kind of the format, and then as far as getting the word out, kind of word of mouth, social media. We have a Facebook page now that's just Parent Academy. So if you go on Facebook and you look up Parent Academy Vero Beach,
very nice.
That should be there. It would literally just open it today.
And did I miss the date?
It's March 1st.
March 1st. So coming soon.
Absolutely. Yeah, we wanted to space it out a little bit from Family Fun Fest, but not too far, and then not into spring break. So this is right before spring break, I think. And
are reservations needed? Since
you
it's
can
classroom,
you can
have
register.
A
you can register online, and there is a QR code, and it should be on the website as well. And with the flyers that will be given out, there'll be a QR code on that, so people can register that way. We would like for people to register just so we have an idea of
if
how
we
many
need two
people.
classrooms per subject instead of one. Or,
Yep. Yeah.
Okay.
So we're hoping, to fill around 100 people. We're hoping for the first one, and then kind of go from there.
So will it be focused on all ages, mostly elementary, middle school? Or?
It's kind of all ages. There's going to be a speaker on school success and how to help your teenager to be successful in high school. Okay. We've talked a little bit, I don't think for this one, but I think in the future we're going to have someone focus on college readiness and how to get your junior or sophomore, like what steps they need to take as far as preparing to apply to college.
Yeah, because you only go through that once or twice.
Right,
it's not something that just rolls off of your experience level.
I was counseling one of my private clients a couple of weeks ago, and he's a junior, and we were talking about the process, and he didn't understand a lot of the steps that are there just because it hadn't been relayed to him.
And they keep changing.
Right, exactly. That's right, yeah. So it's like, helping parents understand those things. And we have maybe 20, 30 topics that we want to narrow down to 10. So obviously there's a lot of things that we would like to share, and we have experts in our area that want to share those things. So like I said, hopefully this will be the first of several of these events.
Yeah, and I work a lot with the Moonshot Community Action Network, which was designed over a dozen years ago to try to get our youngest children best prepared for the rest of their school life. And so the goal was to have 90% of our third graders reading at grade level before they hit fourth grade. Because up to third grade, the teachers and the parents are all working on language skills and how to read and phonetics and all of that. And after that, they need to be able to read to learn themselves better. And so we haven't hit 90%, but we are part of a group that continues to see those numbers go up, and every percent means we've got another successful child.
Yeah, I love the Moonshot initiative. Yeah, and honestly, at the last Moonshot meeting, I was kind of brainstorming while we were there, and a couple of different topics came out just from that meeting. So, I think going forward,
we were always taught, kids are sponges, and they need to have playtime. Well, you can have play and learning together. And the more we found out about brain creativity, the more we've understood that, yes, they're sponges, but only to a point. And then those unused synapses kind of get cleared by the brain. So we need to maximize them from even before they're born.
Absolutely. So. And I'm glad you mentioned that about play. That reminds me, one of the topics will be the importance of play with your children. So that kind of feeds into that whole
I'm glad to
concept.
Hear that. Yeah. Well, we've run out of time again, Wes. We didn't have an agenda other than talking about those two things. But I think we covered a lot, and I really appreciate you being here and all you do for the community.
Well, I appreciate you saying that anytime.
Okay.
It's great to be here.
So anytime means 4:30 on Saturdays every week. Come on back to your radio for more interesting guests, and have a wonderful afternoon. Take care.